I want to move on next in Woman's Hour to a new study. This is to examine the disproportionate number of female teachers developing asbestos-related diseases. So it's backed by teaching unions. It's hoped the findings will put more pressure on the government to take action on asbestos in school buildings. The number of women overall dying of diseases such as mesothelioma, a terminal lung cancer caused by asbestos exposure, they remain relatively low compared to male deaths. But female death numbers have doubled since the 90s, while the number of men dying went up only by half. And figures from the HSE, the Health and Safety Executive, show that those working in buildings such as schools and hospitals, which would be teachers and nurses, predominantly women, are disproportionately affected by the disease. I'm joined now on the programme. You're very welcome, the Joint General Secretary of the National Education Union, Dr. Mary Bousted, and Peggy Walker, whose mother, a former teacher, died from mesothelioma in 2018. First, Peggy, I'm very sorry for your loss.
Thank you. Thanks.
You're both very welcome. Let me turn to you first, Dr. Bousted, because I'm mentioning there may be asbestos-related deaths, and of course everyone is incredibly sad, as Peggy knows. But with the grand scheme of things, the number of female teachers dying from mesothelioma are extremely small. 112, they say, in 9 years, but only 19 of those born between 1955 and 1974. Why is this such a concern to you?
Well, for two reasons, really. The figures, you're quite right, are small, but female teachers are, 40% more likely than other women to contract mesothelioma. And the figures may also be small because after the age of 75, it stops being recorded as an industrial disease, because the idea is that by the time you're 75, that it's not the industry that's caused it. But with mesothelioma, it's a cancer which has a latency period. It can have a latency period of decades, so you can catch it and not know you've got it for decades, and then it manifests itself. And then once it has manifested itself, it's a death sentence. And the other issue, and the reason why we think there are greater numbers of female teachers getting that, is because school buildings built between 1945 and 1970 are riddled with asbestos, and they are the buildings which the DfE now say are in a critical condition. And we are concerned that the asbestos in those schools is either in a very poor condition and maybe leaking fibres, or that it's not being properly managed. So we think that this is a growing concern.
I will say that the HSE says all schools have an asbestos management plan in place, that they're currently running an inspection campaign in schools to make sure the plans are followed. The Department for Education says since 2015 it's allocated £13 billion to the essential maintenance of school buildings, including asbestos removal, where that is the safest course of action. What would you respond to that?
Well, I would say that the HSE inspections are really about whether the school has an asbestos management plan. But we want inspections which actually targets the asbestos, the state of the asbestos, the quality of the air, and more than just whether a school has a plan or not. Because our concern is that too many schools have a plan, but they're not really clear where the asbestos is, and certainly not clear about how it's being managed. And of course, schools are unique institutions, if you can be uniquely unique, which you probably can't, but they're full of children. Children are boisterous. Children bang against doors, they bang against walls, and they're overcrowded buildings. We build our schools too small, and so the danger in schools is that there could be, and probably are in too many schools, far too high levels of asbestos fibres, and that's just simply not known about. We don't think, the HSE are doing a targeted study. That's a beginning, but really what should have been happening is there should have been proper HSE inspections in schools, particularly in the buildings built from 1945 to 70, and those should have been targeted on asbestos.
The latest study will focus on female teachers born between 1955 and 74, as I mentioned, so women in their 40s to 60s. And I'll come back to that in one moment, Doctor. But I want to turn to Peggy for a moment. And I want to hear about your mother. She was a former teacher. Tell me her story.
Yeah, she was a lovely mum, fun-loving, very caring as a mum and as a teacher. So as a mum to me and my brother, and a caring, loving teacher to, countless pupils. And she is dead because of her job. And she was a teacher in a primary school, teaching children with special educational needs, teaching lots of people to read. She was diagnosed with mesothelioma when she was 64, and she died when she was 67. Her attitude to it all was very calm and accepting, mostly because she was a very lovely person. But I was, and still am, very angry about it, because this is a known problem. This is a cancer. This is a cancer that is preventable. A lot of cancers aren't preventable. Mesothelioma doesn't need to exist, and it exists because asbestos is still in buildings.
Did you get concrete evidence that her cancer was caused by one of the school buildings that she worked in?
It's very difficult to know when you're exposed, because, as Mary mentioned, you can be exposed to asbestos and not have a problem for 10, 20, 30, 40, 50 years later. So she was a newly qualified teacher in Manchester in probably the 70s, I would say. So she didn't know when she was exposed, but mesothelioma is that the massive, all of the cases pretty much are caused by exposure to asbestos. And we had to have an inquest, and the coroner ruled that, she was killed by mesothelioma, which is caused by exposure to asbestos at some point.
And then let me turn back to the women really that you're focusing on, Dr. Mary Bousted, which are between their 40s and their 60s. Why them now?
Well, we got asked to provide membership for the study. It's not a study that we're doing. We're just supporting the study. Well, because we want to find out, what the trends are now. We know that 75% of teachers are women. Those women, and indeed the children they're teaching in those schools built from 1945 to 1970, which will have a lot of asbestos, they are the ones which the Department for Education has set up the highest risk of crumbling buildings. If the buildings are not in good condition, then it is more likely that the asbestos is in danger of being exposed. That's a real worry towards us. I mean, the government's, the state of the school estate now is, according to the National Office, Audit Office, very, very bad. And the DfE has increased its risk of school buildings collapsing to critical very likely in the risk register. It's one of their biggest risks. Now, they're not saying that schools will collapse to the imminent danger of children and teachers in them, although a school did find the ceiling to its dining hall collapsing without any warning. But the fact of the matter is school buildings are in a bad state. And these schools, which were built quickly after the war, post-war, quickly, system-built schools riddled with asbestos, it's really important we know what's happening there.
A little more from the Department for Education. They say we take the safety of children and those who work in them incredibly seriously, which is why we expect all local authorities, governing bodies and academy trusts to have robust plans in place to manage asbestos in school buildings effectively in line with their legal duties. Let me turn back to you, Peggy. I mean, do you think this study would make a difference?
It feels like gradually more reports are coming out, but still nothing is being done, meaning that asbestos is still there. The health and safety executives saying that they know it's a problem, they know it's there, but it's safe if it's undisturbed. But it does get disturbed, and it will get more and more disturbed as these buildings deteriorate.
I want to turn back to you, Mary, as well, because we can't have you on the programme without touching on the imminent teacher strikes as we talk about schools by the National Education Union. You're planning 7 days of strikes in February and March, the first being in both England and Wales. That'll be next Wednesday, the 1st of February. And people will be asking, why should pupils' education suffer and also working parents have their lives disrupted again because your members want more money?
Well, we don't want to disrupt children's education, and we certainly don't want to discuss parents' lives. But the issue is this, that when you have the Chief Inspector of Schools, Amanda Spielman, writing in her annual report in December that there is a workforce crisis in schools because of teacher shortages and support staff shortages, and that children are bearing the brunt of that crisis. When you know that the government missed its secondary teacher training targets by 41% this year and is looking to do the same next year, when you see the industrial scale of lessons being taught by teachers who are not qualified in the subject, modern foreign languages, maths, 1 in 8 lessons taught by a non-specialist, somebody who doesn't have a degree in the subject, then you will realise that what's happening in schools every day now is they're being held together by the goodwill and the excessive work of teachers and support staff, and it can't carry on any longer.
But that would sound like it's not about pay.
Well, it is about pay. Once you've got the reason why you have these shortages is absolutely to do with pay. The reason why you have these shortages is because of poor pay. Teachers' pay has declined by, if you take in CPI, 11% in real terms in the last 12 years. If you take increasingly uncompetitive pay and excessive workload, you come up with the workforce crisis.
I have to leave it there. We'll talk to you again about it, but to you and Peggy Walker, thanks so much for joining us on Woman's Hour.